Hey, everybody, Dr. John McCormick with Ovation Health and our podcast today. We're going to focus on pharmacy benefits. For our second podcast, I thought, we have so many questions coming to us about pharmacy benefits. You know, how come our pharmacy benefit costs less with Ovation Health? And when I was with my previous plan, it was really expensive, and we just don't know from a small and medium employer standard. All right, so today I have with me Mandy Stahl, and she's one of my patient advocates and works a lot with the pharmacy benefits. And of course, Chad is here again with us today, and he's going to add some insight as well. So I'm going to start I'm just going to kind of start with some questions. So my first question is, in our formulary, how many drugs are actually listed?
Right, so approval standards for plans oftentimes are more so around the idealism of where Medicare has set a standard. And so for Medicare, it's somewhere around 1,750 medications, so 1,750. Now, when you break those out into a total formulary, which lists all of the drugs by their specific coding and dosages, you end up somewhere more around 14,000 line items that you have to then load into your pharmacy benefits program or whatever sort of method you're using to portray those pharmacy benefits to your consumer.
So Chad, when you're thinking about that, 14,000, I mean, that's hard to get your mind around to begin with.
Right.
And then when you expand it even further, you know, when I'm looking at a plan document, and then it really doesn't matter which plan it is, what I see is tier one, tier two, tier three, tier four, sometimes tier five and six, and all I know is tier one, they tell me that's generic and I don't have to pay anything or I pay something really low. And
Right.
then tier two, I'm starting to move into name brand drugs, but they're ones that have been on the market a long time. So talk to me about those higher tiers. Why do formularies tier out like that?
Right. So it starts baseline at the market level. Often, from what we see, the U.S. is a very extreme case in that you can patent medications in the United States, which there are laws specifically against in other countries around the world. So in the United States, you can actually figure out the formula for creating a medication that serves a specific purpose. And then, since somewhere around the 70s, you could patent those medications and actually kind of get the exclusive right to that formula. So what we see is these brand name drugs that oftentimes will, once their patent runs out, or once one sort of chemical is changed, but really they're the same, you'll have generics versus brand medications. Now, plans and individuals oftentimes prefer generic medications because of their cost. And what you don't know is oftentimes they're the exact same chemical makeup as these brand name drugs that have these absurd commercials and these these absurd kind of advertising methodologies, and they have a lot of money backing them because they're making a lot of money off of the medication themselves. But they're no different than what you could service you at a much lower cost.
So Manny, switching over to you, we got a lot of great members. We want to take great care of them. I know you're very passionate about taking care of members and making sure they get what they need. But even in that role, you're working individuals through a sort of step therapy when it comes to RX. So bouncing back off of what Chad just said, we know because we're in the space that sometimes those generic or cheaper brand name drugs are really formularically the same or chemically the same as some drugs that you're seeing advertised on the market with cool horses in the beach and all that nonsense, that are $800 or $1,000, but really no more effective. So talk to me about why there's such a value in going through that process, not only so we get the right medication for the right member, but also how that helps us control the overall cost for the plan, because ultimately what happens every year over year? Plant costs go up. Innovation Health, our plant costs don't go up year over year. And we've been able to do that specifically by helping educate people in the formulary and how to use that.
So not even so much on the financial side of it, but on the medical side, you don't you're not going to start at the highest level first, right? You're not going to go when you go to the doctor, they don't break out the big dogs, you know? I mean, antibiotics, excuse me. Antibiotics for one, you're never going to use some broad spectrum antibiotic on a tiny little minor infection in a cut. You know, so you don't want to start high. You don't want to start with the big guns. And so a lot of times that's what those medications are, the brand names, the high dollar tier 5 medications. That's a last resort thing, you know, so that's another reason for the step therapy. If something on the lower level, even if it's lower cost, if that works, why do you want to take it up a notch, you know? So when this disease or illness progresses, if it is a progressive disease, then you have other options. You know, you don't want to use your final option right off the bat. And so a lot of times that's what the members are pushing for. We have a lot of members in the medical field, and they're like, oh, I just want this fixed, and I know this works because, you know, Google tells them everything. And so they want the number one, the highest cost, whatever it is, and they push for it. Clearly they get some incentive for it. So not just financially, but I mean, there are numerous reasons that you don't want to start at the top. And that is another reason that we do the step therapy.
So, you know, I have a military background, so when you say those kind of things, it speaks to me. You know, you're effectively, if you're sick, you're in combat. You know, your body is in combat with the disease. It's in, you know, it's fighting something. So I hear you, you know, and to me it makes perfect sense. You know, you don't want to carpet bomb your whole body when you can, you know, very laser focused take care of something at a lower level. Because if you need to amplify, if you need to go up, you want to make sure you have every tool in the toolbox. But if you start off with the biggest, baddest, maybe the newest thing, sometimes the newest is not the best. I dealt with a lot of weapon systems that were brand new that failed.
Right.
All right, and so we see that a lot. Ozempic's a great. Everybody's talking about Ozempic right now, and
Trulicity and
yeah, Trulicity
Manjaro,
and
Manjaro,
yeah, and it's like, oh, this is the magic bullet for weight loss. Well, we've been looking for the magic bullet for weight loss since the 1950s, when we changed our diet from eating, you know, real food to eating reprocessed garbage. Let's just face it. You know, you don't have to go back too far in the video, you know, photography lexicon to look at, you know, beach loads full of people that were fit and trim. And you're going, how come we look that way in the 50s? And now you look at that same beach in the 2023 and we're like, what happened? You know, did we all get injected with some kind of fat bomb? Well, yeah, we did. And we did it through our food choices, processed foods and things like that. So we kind of went the quick way on the food, and now we're trying to go the quick way on the medicine. And what that's doing is depriving people that actually have diabetes that need that drug, because it's becoming harder and harder to find. And secondarily, we're rushing into a product that we actually don't know what all the bad effects are going to be when used across a population. I mean, you can certainly read the disclosures that they rapidly talk through. This could give you a heart attack and liver damage and da-da-da-da-da. Yeah, but I lost 20 pounds. Yeah, but you died. You know?
Look good in the casket.
You know, what's the catch, right?
Yeah.
And so, you know, we're knowing just right now that this, you know, some new studies are coming out on Ozempic, you know, and it's taken away muscle tissue, generally in your posterior region. It's causing all kinds of internal problems. It's disrupting organs because you don't need this. Your body doesn't need this chemical. So if you're using it to suppress your hunger, which is what's going on, right, you're not using it for what its intended purpose. So it's we call that an off-label use, all right? And the reason we resist off-label uses is because we don't know what the side effects are. And we don't want people to become guinea pigs for the medical pharmaceutical complex. It's just not, that's not good health management. Remember back in our first episode, I said we're in the well care business, not in the sick care business. We want to treat people early. We want to make sure that they have great primary care, specialty care, imaging, labs, no barriers to any of those things, because we want people to live a well life, not get in a cycle of sickness like might happen on some of these other plans where the plan itself is also the owner of the pharmacy that's dispensing the drug, and so what you get into is this cycle of sickness where they're getting paid on every side of the equation. So the sicker you are, the more they make. Our model is not like that. Our model is, we want you to stay well, and we don't make money on all the other peripheral things. So our focus is actually truly wellness and your best intent. So how do you manage getting the best RX for our members, while also helping contain costs, and I know when we engage in healthcare from a member perspective, we're not thinking about money, we're thinking we're sick. All right, we're sick. And the next time we think about money is when the rate goes up next year. That's why we hire an administrator like us, right? Because we're thinking about you're sick and we want to make you well, but at the same time, we want to try to manage your healthcare spend, make you a smart consumer of healthcare, just like you're a smart consumer of buying a car or going to the vet or anything, right? I mean, we want you to be as smart in healthcare as you are in all the other things you're smart about. So how do we help do that through some of the other options and programs that we offer?
So, I mean, it really comes down to member education. We really have to educate the member because a lot of them don't know, your doctor knows best. So what the doctor ordered is what I'm going to go pick up kind of thing. And so while we're, none of us here, well, you sort of, but none of us here are practicing physicians, we'll say that. So we can't advise the member to not take a medication or to take a different medication, right? We can simply educate them on the side effects of the medication that they're prescribed. We can also lean them towards generics, things like that. We also always refer them to the manufacturer website, not only for manufacturer discounts or rebates or copay cards, but to read up, read the literature on the medication. There may be something better for them out there. We ask them if they've considered alternatives. It's something that we're familiar with, that we know someone else has been possibly diagnosed with the same illness or disease, and they've had, better outcomes with a different medication. We can always make those suggestions and just overall educating the member.
So how do we go about, I've heard you talk about international sourcing before. What's that? What does that mean?
So we can't do it ourselves. We, as the TPA or as the plan, we can't order the medication or request the medication. Our PBM, pharmacy benefit manager, does not get the medication from there. But what we can do is we can refer. We have a trusted source. We can refer our members to them, and they can get it from this third party, and it's internationally outsourced, and it only comes from countries. Canada, New Zealand, Australia, countries that are tested and trusted to be, tried and true. The medication, obviously not FDA approved, and because the FDA doesn't govern in those countries, but it's been tested to be good. That's where we won't go through any other company. RX Manage gets their medications from only these companies or these countries that are trusted. So we can actually refer our members to them. They go through them, and it's a third of the cost, I believe, to go through with international outsourcing. Yeah. As opposed to anything in America, any pharmacy, the cheapest that we could get them, the best value we can find here, a lot of times they'll get a third of that, through international outsourcing.
Yeah, and if I may add, oftentimes in these other countries where we are doing the international outsourcing, these aren't for-profit countries when it comes to medical service. And so the big issue versus the United States is obviously every portion of the industry is for-profit in the U.S. And when you go to, say, Canada or Australia, New Zealand, it's more so about making sure that the medication is readily accessible. They have a lot more restrictions in place to make sure that this is the case. And we have, with those specific countries, the United States, an agreement that these medications can come into the country from these countries. So as long as you're able to refer this specific member to these resources, then they're able to find these medications from the exact same medication, just in a different location that isn't trying to gouge them for every penny for the same medication.
See, and we talked about this in the first episode, we were talking about just highway robbery that goes on sometimes, here in the U.S. And it's one of our biggest frustrations at Ovation that we want to break through those barriers. It's part of the reason we're transparent. It's part of the reason we have this podcast to really kind of open the eyes up, or hopefully open the minds up of the employee and the employer to say there is a better way. There's a cheaper way. There's a better way. And sometimes we get it stuck in our brain that cheaper's not better. I want to pay the most money, and it doesn't make any sense. How about I want to pay the right amount of money for the best care? I don't want to overpay for it. I don't want to underpay for it. I want to pay what's fair. I want to pay what's right, and I want to pay what delivers the right, the right prescription for me, as we talk about that. I know we also use 340B, and 340B, nobody, if you're not in the space, don't know what that is, but, federally qualified health clinics are also part of our network, and we can use the federally qualified health clinic as another way approved by the Fed to help drive down that medical spend. So I know you've used some of that in the past, Mandy. Talk about that a little bit.
Yeah, the only downfall that we find with that, it's great. It is a great source to have. The only downfall that we see is that these 340B clinics require the prescription to come from their physician, right? So a lot of the members are just a little, hesitant. For the right price, they'll go.
Well, the right price is I can pay $500 in which I have a $250 copay or co-insurance, or I can go see this doctor one time virtually now, all right, get the prescription mail ordered to me, and it's $50 where I have a $10 copay. That's a heck of an incentive.
It is, but we also live in this world of convenience where these people are just like, I've had the same doctor. They don't like change or whatever it is. Older folks, they don't like the change, so they're going to stick with what they've got or what they know.
I am right here.
And then you've got the Chads in the world that are, they're just like, I need convenience. Some of them are more about convenience, and so to have to go there or to change doctors or something is a bit of a headache. But for most of us who are financially aware, I guess, if you do any little bit of research, and we do, we try to, again, part of the education, we educate people, give them that option, and so when you make them aware, they're willing to make that switch. But,
right. So it's really, at the end of the day, it's consumer choice, right?
Absolutely.
We're saying, look, we kind of have a slogan in our office. We don't say no. We say not that way. And the not that way is what Mandy's talking about. Education. We want to make you a smart consumer. So if you're listening to us and want to do that, you can be a smart consumer. And I'm the old guy in the office that goes and sees a doctor. Everybody else uses virtual medicine, all right, which I think is definitely now post-COVID the trend. Pre-COVID it was about 5%. Post-COVID we're seeing almost 40%. The studies that I'm reading are saying that we're going to end up with 80% of our primary care and specialty care in the virtual space, probably in the next decade. And that's just because the younger people are like, why would I go sit in a doctor's office when I can do this on my cell phone? It makes perfect sense. And guess what? That's what we're going to talk about in our next episode is virtual care, the options that it brings to the table, the power that it brings to the table, and how it's reinventing the healthcare space. That's all we got for today. Thank you for tuning in to the Ovation Health Studio, the Pulse of Healthcare.